Jim Joyce.
We did it, man. It's two.
We did it. 2 in a row. Just for those who are joining us, because we're just blowing up out there, I'm Eugene, co-hosting, and welcome to the Shot of Digital Health Therapy that we resurrected or revived just last week. So,
yep. It's the revival. The revival of the Shot of Digital Health.
It's the revival, totally. I do have one, because we are meticulously unproduced, right? So just, and we're not stitching any of this stuff together. Let's do this.
Let's make it happen.
Can you hear it or no?
No.
Don't do this. Okay. I got this now. I got this now. 3, 2, 1.
Born during the pandemic, we're here to ease your mind.
All right, enough of this. Let's get moving. I know we got an awesome guest waiting already, so we can't wait. But lightning fast.
Yeah.
I think today, Providence Health System announced a partnership with Microsoft around Gen AI, specifically in oncology. I thought it was actually very fascinating because this morning I listened to Harry Stebbings' 20-minute VC with Sam Altman on, and they're talking about enterprise and enterprise scale. So I just always wondering if any of the listeners, I would love some input. How does that work? It's like a frenemy. I mean, obviously Microsoft owns a big chunk, and but yeah, I thought that was interesting.
Yeah, that is one of the most fascinating relationships, right? They own it. They're so embedded with the enterprise. Everyone has an AI model. Everyone has an angle. Everyone's grabbing the pace of it, right? So it's kind of hard. It feels like everyone's kind of keeping their hands in multiple places, and we'll see some consolidation happen. But hard to make a call, right? Like in 5 years from now, is that going to be a Microsoft deal or an OpenAI deal or some combination of?
Yeah, agreed. I mean, it's funny. We can talk about this topic alone probably for the full hour. But what else? What else are you tracking or saw? I don't know.
Yeah, I mean, it's hard, when I just kind of did a little survey and I was looking at the announcements that came out of, that conference a month ago with HIMSS and what was happening, just to keep myself. One thing struck me was this idea, this concept I hadn't heard of, staying with the theme of AI again, was this idea of ambient AI. So that was all the announcements. When I looked at all the announcements, it was like either back-end workflow tools or AIs of the 15 announcements that I saw out there. So there was a company, I think you'll know the name, Abridge, had just raised about a month ago a big $150 million. $150 million seed round. And they announced doing a big deal with the University of California to implement ambient AI. And from what I can understand, what ambient AI is, it's kind of passive listening that's happening through the EMR system, but even ultimately through audio recording devices. So I don't know. My take is we're going to be gagging on new technology right now because the technology space is just moving so quick.
Well, I just I couldn't remember, but it's Shiv Rao, MD. Let's see if we can get him on this pod one of the days.
Yeah.
So let's
have him explain.
Have him explain.
Ambient
and also, listen, I know we're $4 trillion dollar system, right, in US alone, and there's definitely a lot of waste, and it's interesting to I think last discussion, a lot of money is flowing into the back end, right, the optimization part of it. But also assisting docs, right? I mean, there is 1.2, 1.3, 1.5, I can't keep track of, million doctors, right, out there. So anyway, and then I saw quickly, but I don't want to dwell on that one just because, Amwell got the nice note of delisting. I think they got something like 6 months because the stock price is below $1. I think the Schoenberg brothers have been at it for a while. We had some news, I think last week or the week before, in Teladoc, right? Gorovich stepped down. So I'm curious what the buzz will be at the ATA conference just in a couple of weeks around, Telemedicine Association. So it'd be interesting what's being talked about on stage around it.
Right,
But
right. I think we'll wait. We'll wait to hear what you hear in the buzz. I know our friend. I know our friend Murray just left there, right? Conversa. I just saw some announcement that
oh yeah,
he.
I didn't see that.
Yeah, yeah,
Okay.
they left there. So anyways, probably to be reported when you go into the ATA conference to see what the buzz is.
Sounds good. Well, I know your friend. I'll let him in as you're welcoming him in here.
Yep.
Dave.
Well, yeah. So like I'll tee Dave up as he's trying to get on his Zoom call. So we got Dave Griffiths. So this is probably most exciting guest of the season so far. Dave Griffiths.
Ooh, so
He's calling us in from Kentucky. So we asked for a charming Dublin native that lives in Kentucky that is tackling the field of nonprofit healthcare. So just a super active guy in the whole conference space. Has kind of moved into healthcare over the last, I think, it's like 4 years. But I'll let him kind of walk through his own background. Dave, did we got you on video there?
Let's see. There we go. There we go.
now we do.
Yes.
Yes.
Great to be here, Dave, guys. I was just sitting there. You made me wait for like 5 minutes, and I was sitting to myself. What are all the bad things that Jim Joyce is saying about me right now? It's definitely a tactic from Jim to put you on edge.
I was just going to say that you probably thanks for putting the shirt on before you turn the camera up. So
I know. But great to be here, Eugene. Great to meet you, and
yeah,
very
same.
happy to be on this. I've seen obviously quite a few of the podcasts on LinkedIn, so it's been great to see you guys been getting it back up and running again.
Well,
yeah,
as we always say, we do it for our own mental health. So we're just sucking energy from you. And same thing. I was looking forward to meeting you.
Yeah. So Dave's a great energy giver. So I don't know. So Dave, Eugene, nice to meet. I'm surprised you guys haven't met because you're both on the health tech conference circuit so frequently. But maybe Dave, just give us a little bit of a background. Take us from the from the edges of Dublin to Kentucky.
we got time, by the way. We can do this.
Yeah, how long do you have? Great to be on
into
here.
the healthcare. Yeah. Awesome.
Yeah, Dave Griffiths. I'm the VP of Development for Accessia Health right now. We are a non-profit patient assistance organization, so we help people with their co-pays, premium assistance. Also do travel, out-of-pocket expenses for medical supplies and medical devices. And I started off, actually, I've been involved in the health industry for quite a long time. A lot of my non-profit experience is in raising money for health charities, but this is the first time I've actually been involved in patient assistance. And I'm originally from Dublin. Came over to the States when I was 19 on a soccer.
I couldn't tell, by the way, with the accent. So
yeah, I know. Well, I tell people, I'm based.
It was a little bit of a Kentucky.
Yeah. There is a bit of a Kentucky twang there, So I've been in the States now for 34 years, and most of that time I've spent in the nonprofit sector, primarily raising money for health charities. I really kind of cut my teeth raising money through workplace giving for an umbrella organization that represented American Diabetes, Leukemia, Lymphoma, Susan G. Komen, St. Jude, all those great brands of charities, and directly competing against United Way in the workplace. So it was great opportunity to kind of learn the industry and learn how to fundraise. As I said, I came over here when I was 19, played soccer in college. Unfortunately for my wife, I met her in college, got married, and had 3 kids, and now I'm stuck. That's the story.
But actually, I got one more question. At 19, what made you move to Kentucky? And no offense to Kentucky, just
no. I mean, well, that was, and I've spoken to Jim quite a few times about this. That was the opportunity I had. When I was 18, left high school, had no opportunity to go to college based on cost and my own stupidity. So lack of knowledge there. But, I was good at playing football. And I realized, Eugene, at a very early age that I wasn't going to play at the top level. I could play a fairly good level in Ireland, but there was no, there was no idea of what I could do at the end of the day. And I decided to take a chance and take a scholarship to come to the States and play. A lot of Irish lads were doing that back in the late 80s. They were going to American colleges to play soccer and also for track and field. And so there was a lot of kids in my area and around Dublin that were taking that option. And back in '88, I got selected to play on a regional tournament that played in Louisville or in Lexington, Kentucky. And I just, we won I played for another 21 Irish regional team, and we won the tournament. And after the tournament, the coach of the American team that we beat in the final came up to me and said, "You played really well, congratulations." And I said, "Thanks, can I have a scholarship?" So here I am 34 years later asking people for money every day. So it's worked out great, you know. But that's how really
That's
I just
awesome.
looked at it. In Ireland, it was difficult at the time. In Ireland, the 80s was difficult. There wasn't many jobs. It was a tough industry, a tough economy. And I really, honest to God, I thought I would just be here for 4 years and then go back with an education. And as I said, unfortunately for my wife, we met in college and got married. And the rest is history. It's all downhill from there.
I love the story, Dave, like not to embarrass you, but like the other one was he didn't tell the other Irish kids that he had asked for the scholarship until he was on the plane on the way back because he was afraid they would beat the shit out of him. Or
well, I wouldn't say that. I just didn't want anyone else going up to the coach and say, "Hey, I played well too." You know?
yeah, exactly. I love
that. Well, I don't know. Just reminiscing on sort of high school, college, or early college. Just very, very quick sideway. I don't know if I ever told you, Jim. So I grew up kind of in Washington Heights, right? So yes, born in Ukraine, but grew up in Washington Heights, New York. And right above Washington Heights is Inwood, right? And Inwood is highly Irish neighborhood, at least at the time it was, right? So that's where I got my first taste of being friends with Irish people. So. Just I don't know. Side note. I don't know. I don't know if
he's trying to shake. He's trying to shake him off. He has a quota for Irish guests that are allowed on the podcast, Dave. So you might have blown out the quota here. You know, like.
I see. I guess I fulfilled that quota today, I guess.
But then one more last thing, just on the background, because I think this every time I interact with Dave, I feel like this shapes you too. Is then you went on before you kind of entered industry, you went on to coach for pretty competitively.
Yeah, so I coached in college. I actually coached I was one of the youngest coaches in the NCAA back there when I left college and went on and coached in Division II school. I was 24 and a lot of my players were 23. I brought a couple of people over from Ireland to play that were mates of mine. But, it was interesting. So I cut my teeth doing that. And then I coached Olympic development and club, at a quite high level here in the States. And then I coached one of the interesting things, though, and I tell us all the time, is that one of the best experiences I had was coaching a high school girls soccer team in the United States, because it was an amazing study on how you can motivate teams and how you can, be very strategic about what you're doing on a day-to-day basis. Because the high school level of high school girls soccer, this was in the early 2000s, and the US women's national team were just, conquering all before them, winning World Cups and basically just destroying teams left, right, and center. And I modeled this team on the books I'd read about from previous coaches, Tony DeCicco and Anson Dorrance, the women's national team coaches. And it was really interesting because in the high school arena, you get to practice every single day. And, you have 2 or 3 games a week, and you're there with your team every day for like a period of 3.5, 4 months. So you can actually shape something. You can actually do something, rather than when you think about coaching a regular team outside of high school, it's 2 times a week and then you play on the weekends. So for me, the coaching aspect has been really important for me as I look at the strategy of what I do on a day-to-day basis in my job. But also being able to deal with people. We very much believe that being involved in a team sport helps you in your job on a day-to-day basis, being able to deal with other people, good, bad, or indifferent. So yeah, I'm very much a proponent of how sports interjects with business and strategy, obviously.
Totally.
We actually had a whole discussion, Marty and I, and we may have more of that around, treating the team as a family or as a sports team, right? So we can probably spend quite a lot of time on that alone, but it's I see both aspects of it, right? But.
Well, and I think it's interesting because, I've obviously been involved in the nonprofit sector. One of my big passions is having the nonprofit sector be very strategic in how it interacts with for-profit businesses. And that's something that I think a lot of nonprofits struggle with. They tend to bring in, and I know, Jim, I've talked to you about this, is that you walk in as a nonprofit into a for-profit business, and you generally have your hand out or your cap out and you're looking for money and you want support. So you tend to go in there with this attitude of, I'm really depending on you today to help me. Whereas what I've always done is, if you think about it from a strategic coaching standpoint, is I walk into a company and say, how can I help you today? How can I help you be more strategic? How can I help you achieve your goals as a company? And it really turns the conversation around and helps nonprofits be, obviously more professional and less non-profity, but also helps sustain that income for that company, for that nonprofit, because now you're actually talking about the goals and objectives of a company, rather than just saying, can you give me X amount of dollars so I can do this program?
Yeah, it's funny, when I met you the first time at Assembia, right? Like Assembia, you literally, we had, and he's become besties with Laura Hamilton, and we have to give a shout out to Elizabeth Johnson, and but it actually reminds me of you, Eugene, too. Is that like the first thing when you interact with you guys, it's like you kind of walk in and say, hey, what are you doing? How can I help you? What's going on? What's your business? And it's very disarming, right? Like all of a sudden you're like, okay,
okay, I'm in.
But I was saying, it's like you were helping us out immediately. Like we were cranking the conference and creating all kinds of opportunities between Laura Hamilton and myself with Health Weekend, and you were bringing us leads, and then we were bringing you into other opportunities, and it was a real, dynamic that was fantastic.
Yeah, it's awesome.
It's interesting, right? Because I've never worked for a nonprofit, right? But and you kind of introduced yourself initially, corporate development
but you're a coach.
Well, it doesn't have profit yet.
I'm kidding. Sorry, that was bad. It was too easy, Eugene.
Yeah, I mean, fair point. Good shot. I love it. But we're getting there. But the interesting part is that when you're selling a product or service, right? Ultimately, and that's serving someone. I loved your comment, right, Dave? That it's not that you're asking or begging for money. You are delivering a service or a product. You just I never thought of it that way, right? And actually, my question was going to be like, doing corporate development for a for-profit, my thought was product or service. Nonprofit, well, that should be easy because you're doing a great deed for someone, a lot of people.
Yeah.
Selling that should be easy, but obviously it's not, right? It has its own challenges, if not more.
Yeah, but there's lots of challenges. I mean, I think the main challenge that you have when you are in corporate development or development for a nonprofit is the perception that people have of you. And so you think about it from a standpoint of, and I learned this lesson very, very quickly. I had, and I'll drop some names here. Well, again, from a standpoint of looking at the enormity of it, I had a meeting with Coca-Cola, and Coca-Cola, obviously a huge company. This would be life-changing for the organization. And I learned very quickly that Coca-Cola is number 1 on my list of things to do today, but I'm number 25 on their list of things, as I come into the meeting. So when you walk in, you have to jolt their attention because you are not on the top of their list. And even though you may not sleep the night before because you're so excited because you've got to meet with Coca-Cola, you have to go in there with a very strategic approach. And one of the things that I found very quickly was, can I make a connection between what this organization's mission is and what this company's mission is for its employees, because I was doing workplace giving, but also for its bottom line, because at the end of the day, I was representing health charities. And I went in and didn't even talk about fundraising. I never, one of the things that I've found is the hardest thing to do in fundraising is to not actually ask for any money. Because if you go in and have a conversation for a half an hour about strategy, about the health of employees, about how much you're spending on diabetes or asthma or whatever it might be, and how we have webinars and we do this and we bring this into the workplace, you don't have to ask for money anymore because they're going to give you money at the end of the day. And so I think
there's a funny statement that I've heard, if you're asking for money, you get advice, but if you ask for advice, you get money, right? So, or give advice, maybe you get money for that advice, right? So
yeah, definitely.
Yeah. I think I always like the idea of, kind of the with or like, I'll be successful with or without you energy, right? Like that's kind of the, so, hey, nonprofit is achieving incredible things and we're doing lots and we're going to be successful and we'd love to have you with us, but still be successful without you, right? Like if you can get that energy into the thing versus
Well,
like
that's also a scary
Coca-Cola,
thing.
if I don't get Coca-Cola, you know, my year's over kind of.
That's also a scary thing. And one of the things I've learned, Jim, and this is, I know the HealthXL, for instance, you know, that great organization with a lot of entrepreneurs and founders. And by going to some of their meetings and seeing some of their webinars, I realized that, to be honest with you, the nonprofit sector is no different to, you know, an up and coming upstart company. Because if you think about founders, when they go in for meetings for funding, you think about how they are. And if you're desperate for funding, it's going to change the way that you appeal to these funders. But if you walk in knowing that you have a product or a service and it works and it's going to work, then the type of presentation that you give, I'm sure, is totally different. You know, you have that 100%. Confidence, and you say, I can do it without you. But at the end of the day, the other thing that I learned very quickly was, you know, from a nonprofit standpoint, you have to treat your nonprofit as a business, or else you will go out of business. And that is very, very important, because one of the things that I find, Eugene, is that when I go to, like, if I'm out and people meet me and they say, well, what do you do? And that your response is, I'm in the nonprofit sector, they tend to say, oh, that must be so fulfilling for you. That's great. I'm like, no, you know, and I'm saying to them, I'm like, look, I said, here's the thing. I'm in it because of the strategy of the nonprofit sector. And I throw out a few great stats that I'm really proud of, is that the nonprofit sector is the third largest industry in this country. It employs nearly 14 million people. It's only behind manufacturing and retail in the amount of employees.
Oh, wow.
And it employs like 13 million people. Last year, individuals gave over $500 billion to nonprofits. That's, you know, workplace giving, individual grants, and individual donations. And I always ask people, what do you think those nonprofits do with that $500 billion? They spend it. They spend it. They spend it on programs. They spend it on service. They spend it on software. They spend it on locations. They spend it on their employees. So if you're a company and you want to sell to the nonprofit sector, or you look at the nonprofit sector and say, well, we don't want to do business with them because all they want are discounts and we can't make any money off them. I kind of turn it on its other side and say, the other part of it is 65 million Americans volunteered last year.
Right.
You know, that's a cost. That's about $200 billion in volunteer hours to the industry. And if you think about how you connect with a nonprofit, if you're going to give them $10,000 for an event, that's one thing and it's great and it helps. But if you're actually going to give them money, why not sit in there and talk about how they can strategically help your organization achieve your goals, whether it's through employee engagement, corporate social responsibility, working in the local community, wherever it might be. At the end of the day, we all know that a company wants to sell its product. Well, you can actually work with nonprofits. And I'm on my soapbox here, so forgive me, but there are three things that you can do. I always tell people there are three things that you can do in selling to nonprofits that are really important. Number one, they are a phenomenal client. So if you give them a good deal, obviously you want to give them a discount because they are nonprofits and they are stewards of other people's money. So they're always wanting to make sure they're doing a good job spending money. But they're a great client because if you take care of them and give them a really good deal, they will stay with you as a client. The second thing is that if you talk to a company and give a company a deal, let's say you give a company 20% discount, they won't tell anybody else about that discount because they want to make sure Jim is with them or Eugene is their guy. And so they don't tell anybody else about the 20% that Eugene is giving them or the extra service that Eugene does, answering the calls on the weekend and whatever. If you give a nonprofit a 20% discount and take care of them and answer their calls on the weekend and streamline their services and save them money, they will tell every other nonprofit in the community how amazing Jim Joyce is and how amazing Eugene is. So you have all these other nonprofits. They will share it. And then the third part of it, which people don't understand, is that nonprofits have a 10 or 12 senior level VPs from other businesses on their boards. They have professional people on their board. So if you do a great job for a nonprofit, that board is going to know about it. And that's 12 other companies in whatever different industries and 12 other connectors in your community that you can help us. So I'm getting off my soapbox now, but that's what I tell people when they ask me, what do you do for a living?
I'm just trying to get your Venmo account here. I'm trying to get it through. I'm trying to get that, but I'm sold.
And he was just he was giving advice, right? He was just giving advice to others. That's it. So therefore you transfer.
So Eugene, I don't know where you want to go, but I would love, go ahead, Eugene.
Yeah, no, I just had one because you mentioned like the word community a couple of times throughout. And actually it's interesting because to me, nonprofit, I actually, if I had this like bubble of words that describe nonprofit, I actually would put community as a key component of it, because I think while there are, global and national and maybe statewide organizations, according to US, a lot of the stuff seems to be also happening to communities. And I also picked up the fact that there's a lot of volunteers, and volunteers are typically local. I'm bringing this back a little bit to the health, right? Health happens in the communities. Health happens in the social ecosystem, right? And so I just picked up community as a key component of this, and I just wanted to call it out and get your thoughts.
Yeah, I mean, so I work for a national nonprofit, and so we help people all over the country pay for their healthcare. And as you guys know, I mean, healthcare is a huge issue in this country, a huge problem, and over 40% of US adults have 2 or more chronic illnesses, and that's a staggering amount of people. But the other staggering kind of statistics that we have is that 63% of adults who have a chronic illness have cut back on spending for utilities or food or clothing in order to pay for healthcare. And the amount of people that we help over the course of the last 30 years, we've given over $1 billion to help people access their healthcare. It's in those communities where we really have to make a focus and make a difference, because you have to go to where people are. And what we're finding is that underserved communities, not only do they have food deserts, but there's also health deserts. They find they struggle to get to a doctor's office. And so to kind of give you an outline of what I do, so I go to pharma companies that make products that have a therapeutic focus for our disease program. So we have 80+ disease programs. They're chronic, they're oncology, they're rare. It's anywhere from asthma to Huntington's disease and so forth. And I go to the pharma companies that make those products in that therapeutic area, and I encourage them to give to our nonprofit, and then we go help people. And pharma doesn't have any say. We're agnostic about products and services. They just give us a donation and we help people because that's in their therapeutic area. And one of the things that we're finding is that a lot of patients can't afford to get to a doctor's office. Not only can they not afford to pay for a copay to see a doctor, they can't afford to pay for a copay for a prescription after the doctor's visit, and they certainly can't afford to go see a specialist if they are diagnosed or if they think they want to have some other test done. So that's something that we're trying to do a better job of, and we actually have an initiative in Louisville. So I'm based in Louisville. Our main office is in Virginia. We're working with it's called Healthy People, Healthy Louisville, and we're going into a particular zip code that we found is underserved, and we're bringing in other local groups, hospitals, universities for data, and also church groups, so we can get the word out there that we will help pay for testing for people. We will help pay for their copay, for their premiums, for their health insurance, for their prescriptions. And what we're doing is we're committing to stay for a period of 3 years in this particular zip code and help people, improve their access to health. And our big thing is that we can replicate this, we can scale this around the country, because it's very simple to go into a zip code and stay there. And Eugene, when I worked for an organization that helped health charities, I used to go into the workplace and do a health fair. And that was how we introduced our organizations and encouraged people to give through workplace giving. But that health fair, I went in there for maybe a period of 3 days in October during workplace giving time, and then I was gone. And so what we find is that you can come in and you can bring the big trucks in, and you can have your health fairs or your health weeks, but then you leave. And what are those people going to do? So that's one of the things that we're trying to talk about more with our funders, with pharma, with other companies that are involved in the health issue, is that we need to be going into these areas and being able to give people access to care. And one of those things that we have built into all of our programs is a transportation part of our donations, so that you can will pay for an Uber ride or a train ride or a bus ride, wherever it might be. We will help you get to that doctor's office.
And actually curious on that, like Ubers and Lyfts, they are potential givers. Also, I mean, you mentioned you're approaching pharma, but if I look at our, 4 trillion healthcare system, about 300 to 400 billion ish spent on drugs, right? But you actually, and I thought, but it's a larger, meaning the organization actually provides transportation, doctor visits, copays, other things, right? So
yes,
there could be other players. Okay.
And in fairness, Uber does have their own Uber Health section where they are working with different organizations to provide that. So what we do is we will reimburse people for that. We will help them pay for it. And as
Got
part
it.
of what we do as an organization, so if you have a disease fund, let's say for asthma, there's a predetermined amount of money that we will allow people to have over the course of the year. And they use what we call a little PEX card. And when they go to their pharmacy, they just use that card and it's automatically logged. The bin code's already in there. So people don't have that many out-of-pocket issues. But other stuff like, for instance, somebody who with asthma has to buy an air purifier or, new mattresses and so forth, mattress covers will help pay for that as well.
So just to make, Dave, for a second, just to make this really accessible, right? Accessia healthcare, right? So let's just make this really accessible here. So I've seen you launch a respiratory campaign, right? Like what you did when we were in Phoenix or Scottsdale together at one of the conferences. So maybe just for more on almost on the consumer on someone trying to access this, how would they find out about this possible benefit, or how would they learn about it? What does that flow for like the individual, not so much the healthcare expert? You have the pharma company setting up this funds, and then you start to make it accessible.
Yeah. And so the pharma company doesn't set up the fund. So just to clarify, because of anti-kickback statutes, pharma companies give to the fund. And this is really interesting. And like I said, I spent many years, 18, 19 years raising money for health charities, and then had no idea that patient assistance industry was there. And the patient assistance industry is completely different to your traditional ALS, American Cancer, American Heart fundraising, in that we are helping with co-pays and premium assistance. And so what we do is we develop a fund where we see a need in the community or we see a need in the patient population. Then we go to the pharma companies and say, we have this fund established. It's going to help people with, breast cancer, let's say. I know you make a product in that arena. We would love for you to give to this fund, and then we will help people. And we don't give them any other information other than that. So they then make obviously it's a gift to the fund.
Yep.
And then we go help people. So just to clarify, we set the fund up, then pharma, gives to the fund.
Of course.
Yep. So the other part of it is, being a non-profit, we obviously don't have a lot of money to spend on marketing, and we're, sometimes we're the best kept secret out there. And what we do is we work with provider groups. We tell, if I go to a doctor's office and I cannot pay for my prescription or cannot pay for my service, then the doctor's office then may say, well, there are organizations out there that you can connect with that can help you. And they can even help sign the person up on the campus or at the doctor's office. And that's how they find it. So they go to our website, they can apply on the website. And it is a difficult part, because I just got back from a conference in San Francisco this weekend, and I was working with state departments on maternal health, and the majority of people that were there had no idea we existed, had no idea that we could help patients pay for their healthcare. These are state departments,
I almost feel like that needs to happen at the POP, right? Point of prescription, and I guess this help doesn't necessarily need to start at a medication, right? I guess, but it almost feels like, the particular zip codes, the doctors, the hospital systems, they must have some kind of a registry or some way to point the people to this, right? At the POP, for lack of a better term.
Well, I think the other problem, Eugene, though, is that there is if you think about the time that people have, that a doctor's office has to see a person, and then when it comes to the time to pay, or when it comes to the time that you've been diagnosed and now your next step is, that's when that patient says, oh, I don't have that money. And the patient then says, what are my options? And so we're constantly trying to get with providers, constantly trying to help. It's nurses in the office. They're the ones that are at the point of care. The doctor's already gone to the next patient. It's the receptionist in the office. And so we have to try and do a better job as nonprofits, even though we have limited budgets, to get the word out there. This is what we do, and this is how we can help. And I will say this, there are 6 nonprofits like us that do what we do. And we, as an organization, if we can't help a person that comes to us, we try and give them the contact information of the other organizations, because it's not just about us as a nonprofit. There are, like I said, there's 1.9 million nonprofits in this country, but we try and help patients with those other organizations. But sometimes, unfortunately, all of our, like for instance, with our asthma program, we had to close it within 3 days. It was oversubscribed. We had so many people sign up that we ran out of money. So unfortunately, patients can be bouncing around looking for resources.
And how do you pick, Jim mentioned respiratory, right? And you specifically mentioned asthma now. How do you pick the therapeutic areas? How do you pick the zip code? Like right, there's so many people that need help, and it's, if you can help even one person, that's fantastic. And we all try to strive for it as an organization. That mission is to help as many people as you can. How do you pick these topics?
Well, Jim will respect this. Somebody who is smarter than me does that.
Okay, that's a cop out answer.
No, seriously.
But,
I just go out and try and sell it. But we have a clinical director. She looks at where we're seeing trends. Where there's need, what patient population. And to be honest with you, when we have a lot of people that will fill out forms or will call asking for help for a specific therapeutic area, and we may not have a program for it, so we look at that. And in fairness, we look at what's coming down the pipeline. What are pharma focusing on? What's pharma looking to make products for? Because then we know there's a need out there, because obviously pharma has done a lot more research than we could do, and that's how we do it. And so again, I can't stress enough, as an organization that works with the pharma industry, we have to have our programs already established before we're even allowed to go talk to a pharma company about that product. So we do have to kind of look at that pipeline.
It's so fascinating. Like I think I always say, like if you take a health tech, like a digital health tech company out of the States, and if you look at, say, ones that are trying to launch themselves in like an area like Ireland or even like Barcelona, Spain, Eugene, like anyone that has had that experience of seeing them, is you see the European companies, they could have a whole conference and not talk about money, the cost of the healthcare system, right? They could have a whole conference. And in the US, how things get paid for, and how that, how do you integrate into the payment system is probably 60 or 70%. I remember the conferences you and I were at, is, the clinicians were sitting there with spending all kinds of time trying to figure out codes and systems and how to, fight the system, and how just the divergence in the health system,
Yeah. It is. And the thing is, I say all the time, obviously I'm from Ireland, and my parents, all my family's still over there. And my mom got sick last year. She had a bit of vertigo, and the doctor said to her, well, I'm gonna put you, let's have you stay in hospital over the weekend so we can observe you. And I remember thinking to myself, oh my God, Mom, if that happened over here, your first comment is, well, how much is that going to cost? Well, am I going to sit in a hospital for 4 days and get a $10,000 bill just so you can look at me over the weekend? But that to me is, that's where the care, paradox is really here in America, is that, a doctor is not going to say that to a patient. It's just too costly to do something like that.
Just ideating a little bit also, what are PBMs doing anything around directing patients? And then also, back to a little bit, sorry, I'm just very curious about how the 6 entities like yourself are, I love your comment earlier, sharing is caring, right? Understanding how, and I think we lost Jim here for a minute. He's trying to move around, I guess. So back to pharmacy benefit managers, right? I mean, they got half of the country covered, right? If not more, I think 2 out of 3. And that seems to be an interesting set of partnerships that also could be had based on eligibility, based on the need, and,
It boils down to awareness, Eugene. I mean, just, our main thing is we have to be very careful about who we partner with. So we just want to make sure people know that we're there as a resource for patients, and that's the main thing for us. And we don't really have any partnerships with PBMs or any particular pharma company because of the regulatory issues around that. But we definitely connect with people to make sure that they're aware that when a patient comes to them and says, I can't afford this, and primarily the people we work with on Medicare. So obviously, if you have commercial insurance, you can potentially get a copay coupon. The ads in the afternoon and evening on TV are full of them. But people who are underinsured or uninsured come to our website to see if we can help them access those drugs, those treatments. But certainly it's awareness. That's the biggest issue that we have, which is one of the reasons why I know Jim so well, because Jim, I kept popping up at all these other conferences. Jim was there. He's like, bloody hell, here's this guy again. Well, who the hell is this guy? He's everywhere. My tactic is I have to keep showing up until I no longer have to introduce myself. That's my tactic.
Love it.
I'm getting there.
Listen, why do you think we have the show, Dave? This is, that's it. We just want to show up. Like, oh, these are the guys from the shot, huh? No, so.
Yeah,
exactly. Yeah.
This is the only way I can get a chance to talk to Dave. This is
That's right.
Oh, I get it. You've been trying to reach him, and you're like, well, come on our podcast. Right?
Kidding. He's great.
I thought Jim is probably angling for a Kentucky Derby invitation, but I don't have any tickets for the Derby, I'm afraid.
You beat me to it, Dave. I was literally, that was my next question. When are we getting the invite?
I work for a non-profit.
So do I.
Yeah.
Exactly.
Right.
So, I don't know, Dave, if Jim told you, but kind of towards the end, and we are there. Jim asked his famous question, so I will pass this back to Jim. Drum roll.
So Dave, come with me. We're going to go back in the Wayback Machine here, and you're just getting off the boat to Kentucky.
But
you're sitting there. You're going back to your alma mater, and you're asked to speak at an event, and you've achieved so much in the nonprofit sector, and you've funded all of these fantastic programs that are helping people, and you're going back and people are asking you to talk at this conference to explain how you were so successful. And a young man that was just looks like he had a pair of football boots sitting over his shoulder, and he comes walking up to you and goes, "You're Dave Griffiths. I've heard all about you. You're the famous guy that got a scholarship to Kentucky, went on to such success." And you look at that young, and I'm thinking about going into the healthcare nonprofit sector. And you look at that young man, what's the one piece of advice as he's heading into your sector or field that you would give him?
Great question. And I will tell you the advice that I would give to him, and the advice I give to my kids and anyone that bothers to ask, is always act as if. That is my advice. Always act as if. Always act as if you have the job, as if you have been doing this for 10 years, as if you know everything that you need to know when you walk into an interview. I mean, to me, it's always act as if. And I've been doing that since I arrived off the boat with a pair of soccer shorts on the back. Always act as if. And I think it's important because it helps, especially with kids, especially, when I tell my kids this, my son who's got a great job in Sherwin-Williams last year. He went into an interview and he said, "Dad, I completely aced this interview because I act as if when I'm sitting there," and it gives you that confidence. And it's not arrogance, and it's not it's not deceitful. It's just have that confidence in yourself to be able to sit there and then be a sponge and take in and learn. But if you act as if, I think that to me is something that I've always tried to do, and like I've said, on this podcast today, the nonprofit sector, I've always acted as if the nonprofit sector is just as important to the health industry as a pharma company. And you think about how pharma companies, how they think about themselves. They're making a product that is saving people's lives. They're doing this or doing that. And this small little nonprofit over here just is thankful to get any kind of help they can get. That's not the way I think about it. I always act as if I'm just as good as that pharma company that is doing great things, and we can do great things together. So that would be my advice.
Love it.
Great advice.
Dave, fantastic meeting you. And what I took out of it is manifest your future.
That's right. Well, thank you guys. Yeah. I really appreciate the invite. I may not get another invite back again, but if you ever want me back again, I'm happy to do it. But it's been a
How about
pleasure
next
to
week?
be here. No. Yeah, we'll see. We'll see.
Pleasure.
Awesome.
And for those joining us today, please hit subscribe, pass it on, and see you next week. We promise.